Welcome back to the Daily Drum on WHUR and Sirius XM channel 141. This is a truncated edition of the Insight segment. I'm Harold Fisher. Now, you may encounter them in just about every profession there is. Social workers can be found in public service, local and federal government, private industry, indeed every level of education. Well, this is Social Work Month, and tonight we take a look at the job, how it has evolved, and what it actually takes to be a good social worker. Dr. Tracy R. Whitaker is an associate professor and associate dean for academic and student advancement at the Howard University School of Social Work. Dr. Whitaker, thank you so much for joining us.
It's my pleasure. I'm glad to be here.
So let me ask you first, when people often see the title social worker, and there are just so many, you've got clinical social workers, licensed clinical social workers. What are the various and sundry differences, and how do they also differ from psychologists?
Well, social work is a broad profession. And within that profession, there are a lot of different ways that people can contribute. What draws people to the profession is they want to change something. They either want to change circumstances for individuals, families, and groups, or they want to change things for communities and organizations. So within social work, um, as I said, there are a variety of roles that people can play. And so what we talk about is kind of the direct practice route and what we call the macro route. So the direct practice route would involve working with individuals, families, small groups, and it can include anything from providing therapeutic services in an agency to private practice. So it's kind of that clinical track of intervening with people around, challenges that they may be having. On the macro side, that's what we talk about. How do we influence policy? How do we shape agencies and organizations to be most responsive to the people they're set up to serve? So that's where people come into how people come into social work with one of these two kind of ideas in mind. We differ from psychologists because of the breadth of our services. So, social workers, like psychologists, can deliver mental health services, can provide therapy to people, but we can also connect families and individuals with resources that they need. We, what we kind of talk about the difference in social work and the other professions in a way is I had a optometrist at one time, and he would
Mhm.
say to me, people are always asking me if I like their hair or what they're wearing. He said, I just see eyeballs with arms and legs, right?
Mhm.
And I thought about that. Social workers see not only the person who's in front of them, but we see their entire environment. We see what their family, we see their support networks, we see their neighborhood. So we see a group of people when we see a person, not just what they're presenting, but we see all the factors that might influence their ability to function successfully at the level that they would like to.
Arguably, we have heard more about social workers and obviously the work they do in the year of the pandemic and subsequent to that. Um, how would you say that the profession and the work has evolved since the pandemic?
I think the one of the outcomes of the pandemic was that it loosened the stigma around talking about mental health. I think it was kind of an undeniable global occurrence where we were all affected. So we were either affected by the loss of loved ones, or we were affected by the change in our environment. We're, now indoors, or some people weren't indoors. But what happened was, I think there was a commonality around help seeking being okay. So we had a meeting this morning, a panel about how to start a private practice, and one of our panelists, Dr. Cross, talked about she wasn't able to meet the demand during the pandemic. And I think as she's a private practitioner, she's on our faculty, but that's something that happened kind of across mental health services. So social work really expanded more. We've always been the number one provider of clinical services and mental health services in the country, but that demand was unprecedented. So I think more social workers are focused on providing mental health treatment than maybe they were a few years ago, and that's been very good for the public. Because we're providing services to everybody. We're providing services to private pay clients as well as to people who are receiving benefits and public support and insurance. So I think that's one of the ways that we've changed since the pandemic. Also, let me just say this thing. Another thing that's clearly happened is people no longer have to come to our offices to get mental health services. So the pandemic forced us to think about telehealth in a new way across the board. And so that's also made it easier for people to access services because they don't have to drive, they don't have to fight traffic and then have their therapy appointment.
So let me ask you about that, because we have seen that in a great many professions post-pandemic, even in the same way that you and I are conducting this interview
Mhm.
right now. And while it may be more convenient, do you lose something by not having a client directly in front of you?
I will say that our profession prior to the pandemic spent a lot of time kind of grappling with that question. Um, there are things that we thought you couldn't do with kind of the distance of a screen. And there are probably people who would argue that, there's something different. I don't know if it's definitely a loss because there's another piece that has been gained, that there is, people can be in the comfort of their home. So you don't have kind of the white coat syndrome of
Mm,
coming into the office and having to kind of work through the nervousness. So that's kind of a benefit. The other thing is that there's no perfect way to deliver services to every single person. But what I think we're finding is that the more options we have, the more people are able to find what is the perfect way for them. I know clinicians who went completely virtual during the pandemic and thought that was going to be how their practice would be, forever. They didn't have
mhm.
to pay rent on a office, that it was working. But they found that some of their clients preferred to come in person. So they shifted their model to also have in-person hours as well. So I think it's not one or the other, but I think we're in a place where clients and consumers can have kind of maximum choice in terms of what works best for them.
The the doctor that you referenced earlier, she was saying that she could not meet the demand of that crush of clients. Are you getting enough social workers? For example, in Howard University School of Social Work coming through. What about men trying to become social workers? Your thoughts on the need for more?
There's definitely a need for more social workers. Our profession is expected to grow in demand by, I think, 7%, according to the Bureau of Labor Statistics, which is faster than most professions. So there's always a demand. But there are other things that, every social worker is not a clinical social worker. So we want to make sure that we're recruiting people who can do who can do all kinds of social work. So, as much as we need our clinicians delivering services to people who need them, we also need our social workers who are examining the policies that might make it difficult for people to get services. And so we need both. So I think, we are constantly recruiting, and there are more than enough jobs for anyone who wants to pursue a degree in social work.
Enough jobs, but what about the compensation? Is it where you, as a veteran social worker and now an academic, believe it? Is it where it should be?
Well, the National Association of Social Workers doesn't believe so. We the theme for this month, Social Work Month, is empowering social workers, and one of the things that association is looking at is is the salaries for social workers. And I think that there's a broad range of salaries. So some people are making very good incomes, and some are struggling to repay student loans. So
Mhm.
what we're trying to do is think about how practitioners can figure out their the best path. In general, one of the reasons we have Social Work Month is really to raise the visibility and the value of the profession, so that we are not just seen as people with kind hearts, but that we're really recognized as an interdisciplinary profession. We work with other professions, and we support people where they are. And so one of the things that I think about is, we are a profession that has its roots in interprofessionalism. And, we talk about that a lot now, but social work has always been in what we call host settings, where the primary service of the agency is not social work. So if you think about schools, for instance, we're in schools to help children who are having problems with social functioning, or in hospitals.
Mhm.
So, yes, in general, the salaries could be increased. And I think some of that is um, helping social workers negotiate better. And some of it is really that policy piece where we talk about how we influence decision makers at the agency level, at the government level, about what fair compensation would be.
You have extensive work in some of the most difficult theaters of social work, dealing with the homeless, dealing with those who are trying to beat drug addiction, and in the cradle of some of those social ills. I cannot imagine the impact that that can have on a social worker. And now I think more than ever, we are hearing about social workers making sure that they social work themselves, take care of themselves. Eh, are they doing that though, considering the workload?
I would say more are than used to. So more
Mhm.
social workers are thinking about self-care than they were 20 years ago.
Mm.
But I would also say that, um, when you talk about, you know, how you describe my work with people who are really having challenging problems, I
Mhm.
can say the problems were challenging, but the people were not. The the people that I had the pleasure of working with were more motivated than their circumstances called for. And sometimes I would think I would have given up in this situation, but they didn't. And when you are working with people who are fighting, not like in a sense for their lives, but for their dignity, for their ability to participate in society, it's really hard to be burned out by that. That kinda lights a fire in my soul. So, what I think happens is when you start talking about, the bureaucracy that sometimes accompanies social work,
Yeah.
that's what gets burdensome. But it is not, the day-to-day interaction with organizations or with people. That is what social workers live for. Um, So we are paying more attention to, how we are not burning all of our candles, just, I don't want to say at both ends, but we really want to take time to to replenish our, you know, our wells and, have people support us. But that's why some of that empowering social worker, that theme resonates, because that's when you're talking about manageable caseloads. Those are the things that contribute to burnout.
Yeah.
Um, and sometimes our agencies just need to simply hire more people. And
Mhm.
sometimes we can cooperate with systems because we care about the people, and we say, okay, I'll take on 2 more, I'll take on 10 more.
Yeah.
But really, that's where agencies could really help support social workers.
I'm going to have to let that be the last word. Dr. Tracy Whitaker at the Howard University School of Social Work. Thank you so much for talking to us. I appreciate your time.
Thank you.
Sure thing. That is the Daily Drum for this Monday, March 25th. I'm Harold Fisher. Good night.